Did you know that morning stiffness is not due to age, but to the loss of elasticity in your tissues caused by the lack of daily isometric stretching? Studies published by the National Institute on Aging reveal that the loss of flexibility, joint stiffness, and muscle weakness are directly related to sedentary behavior and the lack of daily stimulation in the tissues. As we age, muscles tend to shorten, joints lose lubrication, and the fascia, the connective tissue that covers our muscles, becomes less elastic, which leads to tension, pain, and a reduction in functional capacity. However, here comes the part that most people don't know. You can reverse much of these effects with just 10 minutes a day. You don't need medications, expensive massages, or complicated devices. What you need are gentle and specific isometric movements, capable of reactivating circulation, elongating the muscles safely, and restoring to the body the freedom it has gradually lost. That's why, in this video, you'll discover the 5 fundamental stretches that every older adult should practice each morning, which have been clinically proven to improve mobility, reduce chronic pain, and even increase balance and neuromuscular coordination. Each of these exercises is designed to adapt to your current physical capabilities without forcing your body or leaving your home. So stay with me, because you're about to learn how stretching is, literally, the natural medicine your body has been crying out for. And best of all, it's within your reach, starting today. Stretch 1. Cat-cow. The cat-cow movement is one of the most complete, safe, and accessible exercises for improving spinal mobility, especially in older adults. This stretch combines 2 alternating positions, one that gently flexes the spine, like a hunched cat, and another that extends it, arching the back like a cow, allowing for progressive movement of each vertebra from the neck to the tailbone. This sequence activates both the paravertebral muscles and the deep trunk stabilizers, including the multifidus and the transverse abdominis, thus promoting better postural alignment, a significant reduction in accumulated tension in the lower back, and progressive release of the thoracic and cervical areas. From a scientific point of view, mobilizing the spine in this way improves the flow of synovial fluid in the intervertebral joints, which is essential for keeping the discs well hydrated, reducing friction, and preventing degenerative processes such as vertebral osteoarthritis or spinal stenosis. Additionally, studies published in the Journal of Bodywork and Movement Therapies have shown that this type of dynamic mobility exercise increases oxygenation of the soft tissues surrounding the spine, which reduces morning stiffness and improves the overall sensation of physical well-being. Even in people with disc herniations or mild scoliosis, performing cat-cow slowly and in a controlled manner, while respecting the body's limits, can help restore muscle balance and reduce painful pressure points. In short, this exercise not only wakes up the back, but also revitalizes your body's central axis and prevents the typical discomforts associated with sedentary aging. In addition to its physical benefits, cat-cow has a powerful effect on the autonomic nervous system. Each cycle of deep breathing and conscious movement activates the vagus nerve, a key pathway for regulating the body's relaxation response, which helps reduce cortisol, the stress hormone, decrease involuntary muscle tension, and improve sleep quality. This interaction between spinal movement and breathing has been documented in applied neuroscience studies, showing that slow mobility practices like this one can have effects similar to meditation or guided relaxation in terms of reducing anxiety and improving mental focus. That's why this stretch is ideal not only upon waking but also as part of a nighttime routine to release tension before going to bed. Stretch 2. Calf stretch. The calf stretch is one of the most important, and often ignored, exercises in older adults, especially if you experience heavy legs, nighttime cramps, or get tired while walking. This stretch targets the muscle group known as the triceps shuri, made up of the gastrocnemius and soleus, which perform a vital function. They support your body while standing, drive movement while walking, and act as a natural pump that helps return blood from the legs to the heart. Over time and with lack of movement, these muscles shorten, lose elasticity, and stop performing their function efficiently. This causes blood to pool in the lower extremities, increasing the sensation of heaviness, swelling, and cramps, especially at night. When stretched in a controlled way, the accumulated tension is relieved, circulation improves, and the sensation of lightness while walking gradually returns. From a scientific standpoint, Regularly stretching the calves improves ankle mobility, prevents falls, and supports vascular health. It also helps release the Achilles tendon and reduce pressure on the plantar fascia, which can prevent or relieve common conditions such as plantar fasciitis or heel pain. Additionally, prolonged stretching stimulates the neuromuscular receptors that regulate involuntary contraction, helping to reduce the frequency and intensity of nighttime cramps. This exercise can be done standing, with one leg extended back and the heel firmly on the ground, or seated, using a towel to gently pull the tip of the foot toward you. The important thing is to hold the position for 30 to 60 seconds per leg, breathing deeply and without forcing. With just a few minutes a day, you'll notice how your legs feel lighter, how your balance improves while walking, and how those discomforts you once considered normal gradually disappear. Remember, flexible calves are a sign of healthy and active legs. Stretch 3. Butterfly. Discomfort while walking, difficulty climbing stairs, or a feeling of blockage in the lower body have a more common root than many think: hip stiffness. This stiffness is a direct consequence of spending too many hours sitting, the lack of specific stretches, and over time, the loss of elasticity in soft tissues such as tendons, ligaments, and fascia. The butterfly stretch is one of the most effective and safe postures for older adults, as it acts directly on the hip joint, increasing the range of motion in the hips and stretching the adductor muscles, inner thigh, which tend to shorten with inactivity. According to studies published in the Journal of Geriatric Physical Therapy, maintaining hip flexibility is key to preventing falls, improving trunk stability, and reducing the risk of chronic lower back pain. The hips are not only responsible for allowing you to walk freely, but they also function as the central axis of your mobility. If they're stiff, your whole body feels it. When you practice this stretch, you're not only working the visible muscles but also deep structures that are rarely activated during everyday movements. The butterfly exercise helps elongate the pectineus, gracilis, adductor longus, and adductor magnus muscles, while also stimulating pelvic opening, improving postural alignment, and reducing the pressure placed on the lower back when walking or standing for long periods. This posture also improves venous return, supporting circulation in the legs, something essential for those who suffer from tired legs, varicose veins, or edema. Additionally, the symmetrical and stable position the body adopts during the butterfly stretch promotes body awareness and balance control, two vital aspects for preventing falls in older age. If you feel a lot of stiffness, you can adapt the exercise by placing cushions under the knees or resting your back against a wall, making it an accessible tool even for those with joint limitations. It's not about forcing, but about allowing your body to open up progressively and respectfully. Practice daily. This stretch not only relieves accumulated tension in the hips and thighs but also gives your body a sense of lightness, stability, and control that you may have thought was lost. That's why many physical therapists consider it a foundational movement in mobility routines for older adults. In just 2 minutes a day, you can retrain your body to move better, walk more safely, and regain an essential part of your physical independence. Wait! If this video has been very helpful to you, we invite you to give it a like, subscribe to the channel, and activate the notification bell, as it will surely be very helpful for us as well. Stretch 4. Child's Pose. Child's pose, known in yoga as balasana, is much more than a gentle stretch. It is a powerful relaxation tool that works on both a physical and mental level. This position consists of sitting on the heels, leaning forward until the forehead touches the floor, or a cushion, and extending the arms forward or placing them alongside the body. It is especially beneficial for older adults, as it relieves accumulated tension in the lower back, hips, and shoulders, areas that tend to tighten over the years due to poor posture, stress, or a sedentary lifestyle. On a biomechanical level, child's pose creates a passive elongation of the paraspinal muscles, the muscles surrounding the spine, the glutes, and the hip joint capsule, without requiring physical effort. This helps release compression in the lower back and restore elasticity to the deep tissues that support the spine. Additionally, by letting the torso fall toward the ground, intra-abdominal pressure is reduced and diaphragm expansion is facilitated, improving breathing quality and providing an immediate sense of relief. This stretch is ideal for ending an exercise routine or practicing before bed, as it helps calm the mind and prepare the body for rest. From a scientific standpoint, it has been proven that sustained relaxation postures like balasana activate the parasympathetic nervous system, also known as the rest and digest mode. This system regulates vital functions such as heart rate, blood pressure, and the release of calming hormones like serotonin and oxytocin. Holding this pose for at least 1 minute, accompanied by slow, deep breaths, stimulates the vagus nerve, which directly affects stress reduction, anxiety relief, and even sleep quality. Studies published in sports journals highlight that restorative postures like this not only decrease the activity of the sympathetic system, which activates during moments of alertness or tension, but also improve body awareness and reduce chronic pain associated with conditions such as fibromyalgia or lumbar arthritis. Another key aspect of this posture is its ability to improve joint mobility without impact, by gently bending the knees, slightly opening the hips, and stretching the back effortlessly. It promotes a safe stretch, ideal for people with physical limitations or joint problems. Moreover, it can be easily adapted by placing a blanket under the ankles or a cushion between the thighs and abdomen, making it accessible to anyone, regardless of physical level. It's not about forcing, but about allowing your body to open up progressively and respectfully. Practiced daily, this stretch not only relieves accumulated tension in the hips and thighs but also restores a feeling of lightness, stability, and control to your body, something you may have thought was lost. That's why many physical therapists consider it a foundational movement in mobility routines for older adults. In just 2 minutes a day, you can retrain your body to move better, walk more securely, and regain an essential part of your physical independence. Stretch 5. Supine Twist. The supine twist is one of the most effective and therapeutic stretches to release accumulated tension in the lower back, improve postural alignment, and stimulate the autonomic nervous system. This movement involves lying on your back, bringing one knee toward the chest, and gently twisting it to the opposite side of the body while keeping the shoulders flat on the floor. It may seem simple, but the physiological benefits it triggers are profound. The controlled twist allows for a gentle decompression of the spinal column, that is, relieving pressure between the intervertebral discs, especially in the lumbar vertebrae, L1, L5, which are most affected by sedentary behavior, poor posture, and loss of abdominal strength. Studies from the Spine Journal and the Journal of Manipulative and Physiological Therapeutics indicate that passive spinal rotations help restore range of motion, stimulate disc hydration, and reduce myofascial tension in the paraspinal muscles. This muscular and joint release is key for people over 60 who experience chronic stiffness, mild sciatica, lower back pain, or discomfort from sitting or standing for long periods. In addition to its structural benefits, the supine twist has a restorative effect on the parasympathetic nervous system, which is responsible for regulating rest, digestion, and recovery. Performing the twist with slow, deep breathing stimulates the vagus nerve, which reduces the production of cortisol, the stress hormone, and promotes an overall sense of calm and well-being. This stretch also stimulates the solar and abdominal plexus, which helps improve intestinal and digestive function, areas that also tend to be affected by physical inactivity in older age. Furthermore, as it activates stabilizing muscles like the internal and external obliques, the transverse abdominis, and spinal rotators, it improves coordination between the trunk and pelvis, which is crucial for maintaining an upright posture and preventing falls. Best of all, it can be easily adapted. If you experience discomfort in the hip or knee, you can place a cushion under the twisted leg or perform the movement partially. You can even hold the twist for just 30 seconds on each side and gradually increase to 1 minute if you wish. This posture requires no effort, but it does require awareness. You must allow gravity and your breath to do the work. Practice daily, the supine twist becomes a natural adjustment your body will deeply appreciate. It will not only relieve your back but also restore a sense of freedom, balance, and vitality you thought was gone. A daily stretching routine not only improves your physical mobility, it also acts as a direct investment in your independence, well-being, and quality of life. And the best part, you only need 10 minutes a day. This routine is designed to be done upon waking, when the body is stiff and needs activation, or before going to sleep, to release accumulated tension and promote deep rest. You can even do it after walking or following light physical activity, as it helps oxygenate the tissues and restore joint and muscle balance. The structure is simple but highly effective. Start with the cat-cow movement, 1 minute, which activates the spine and releases the back. Then move on to the butterfly posture, 1 minute, ideal for relaxing the hips and improving leg flexibility. Next, the supine twist, 1 minute per side, will help release the lower back, followed by the calf stretch, 30 seconds per leg, to improve circulation. Finish with child's pose, 1 minute, which calms the nervous system and leaves the body in a state of deep rest. If you have more time available, you can repeat the entire sequence or extend each exercise up to 90 seconds. But the most important thing is not the duration, it's the consistency. One of the most noticeable and fast benefits reported by older adults who do this routine daily is a significant reduction in joint stiffness and pain. This is because prolonged and mindful stretches increase joint range of motion, promote the production of synovial fluid, the natural lubricant of the joints, and stimulate the elasticity of connective tissues. According to the American College of Sports Medicine, flexibility training in older adults improves limb functionality in just 4 to 6 weeks, as long as it's done regularly. Moreover, by improving overall body mobility, especially in critical areas like the hips, spine, and ankles, the pressure on tense muscles and inflamed joints is reduced. Morning stiffness, which is often related to the accumulation of muscular toxins and poor circulation, can drastically decrease if this routine is incorporated within the first hour of the day. Isometric stretching has also been shown to lower pain thresholds in people with osteoarthritis and chronic lower back pain. In short, more daily movement means fewer medications, fewer discomforts, and more freedom to move without fear. The second key benefit of this routine is injury and fall prevention, a critical issue in the older population. Frequent stretching improves proprioception, body awareness in space, strengthens the neuromuscular connection, and improves both static and dynamic balance. By mobilizing the hips, ankles, and spine daily, key structures are strengthened to maintain an upright posture, take stable steps, and react in time to imbalances. Research published in the Journal of Geriatric Physical Therapy has shown that simple mobility routines reduce the risk of falls in older adults by more than 30%. The third benefit is perhaps the most silent, yet deeply transformative: more restorative sleep and greater emotional well-being. Ending the day with a gentle routine activates the parasympathetic nervous system, lowers cortisol, and improves sleep quality. Deep breathing combined with stretching reduces anxiety symptoms, improves mood, and promotes a more conscious connection with your own body. Altogether, these benefits translate into a more active, more stable, and more fulfilling life. Because it's not just about moving, it's about living with autonomy, energy, and calm. Do you see how simple it can be to start feeling better? You don't need complicated routines, expensive equipment, or endless hours of exercise. Just a few minutes a day, guided by awareness, consistency, and care for your body, are enough to start noticing real changes: less pain, more mobility, better posture, less stiffness, and above all, more confidence in yourself. Because movement is not just a physical matter, it's a way to regain your autonomy, your energy, and that vitality you thought you had lost over the years. Every stretch you do is a silent but powerful investment in your well-being, your balance, and your independence. So now I want to hear from you. Which of these stretches did you find most useful? Were you already doing any of them, or are you going to start today? Write it in the comments, because your experience could inspire others. And if this content brought you value, help us reach more people. Give us a like, subscribe to the channel, and activate the notification bell to receive more practical routines like this one. Share this video with your parents, grandparents, or friends who also deserve to move without pain. Because you're just one step away from feeling stronger, lighter, and freer. See you in the next video. And never forget, your body still has so much to give you, you just have to start moving.